Welcome to MU Healthcare's Women's Hospital, and congratulations on your pregnancy. We are so honored that you've chosen us, and we look forward to caring for you and your family. We believe our hospital is special for so many reasons, one of these being our baby-friendly designation. Lots of people ask, what does it mean to be a baby-friendly hospital? So we want to take a few minutes to tell you a little bit about this prestigious designation. Baby-friendly hospitals educate all patients about the benefits of breastfeeding. They teach how to recognize when babies are hungry and how to safely feed them. They provide hands-on education after delivery and make it possible for mothers to be near their babies as often as possible. Let's take a minute to talk about the benefits of breastfeeding. Your body creates milk specifically designed for your baby, and your milk changes along with the needs of your baby. Did you know that as a breastfeeding mother, when you are exposed to certain germs in your environment, that your body revs up its immune system to fight the infection? Some of these same immune bodies that you make pass directly into your breast milk and help the baby to fight the very same infection. This is one of the reasons that breastfed babies have lower chances of contracting respiratory illnesses, stomach bugs, and ear infections. Breastfed babies also have half the risk of sudden infant death syndrome and are less likely to develop diabetes, obesity, and certain types of cancers. If your baby needs care in our neonatal intensive care unit, your breast milk is a medicine that only you can make. Our littlest patients have special needs, and breast milk is easier to digest than formula. Breast milk can also make it less likely that a premature baby will get necrotizing enterocolitis, a serious condition where part of the baby's intestines become inflamed. Breastfeeding isn't just beneficial for babies, mothers benefit as well. Mothers have a lower risk of heart disease, high blood pressure, and diabetes. Mothers who breastfeed are also less likely to develop breast cancer and ovarian cancer. While science tells us that breastfeeding is a healthy choice, we know that it isn't always easy. This is why the baby-friendly hospital designation is so important. If mothers choose breastfeeding, we want to do everything we can to help them be successful. Hospitals that follow the 10 steps to successful breastfeeding help mothers achieve their feeding goals. If mothers choose to not breastfeed or cannot breastfeed, we want to also provide the best education needed so that they too can safely feed their babies. The American Academy of Pediatrics, the World Health Organization, the American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, and the Centers for Disease Control and Prevention all recommend exclusive breastfeeding for the first 6 months of life. This means that infants drink only breast milk until the baby is 6 months old. At 6 months of life, pureed foods can then be added along with the breast milk. The World Health Organization and the American Academy of Pediatrics now recommend that mothers feed their children breast milk until they are 2 years old and even longer if mutually desired. So what does having a baby in a baby-friendly hospital look like? After your baby is born, we will place your naked baby on your bare chest. We like to do this as soon as possible and keep you snuggled for at least 1 hour. Placing your baby on your chest helps regulate his or her breathing and maintain body temperature. Babies transition from the world inside the mother's body to the world outside her body much easier when placed skin to skin. This time allows both you and your baby to bond. If you are planning to breastfeed and your baby hasn't nursed by the end of 1 hour, we try to keep you snuggled until that first feeding is complete. In most cases, we delay measuring, weighing, and examining your baby until after your baby has been skin to skin and breastfed. After you and your baby are both stable, you will go to the postpartum unit. This is where you will spend your remaining time in the hospital. Our healthcare team will support you as you get to know your baby, as you physically recover, and as you learn how to care for both yourself and your new infant. We work very hard to keep your family together while you are with us. Studies show that babies do better when they are close to their mothers. They eat more frequently, they cry less, they lose less weight, and are less likely to develop jaundice. Many mothers believe sending their baby to the nursery will help them get more sleep. but some studies show that moms who keep their baby near them, or room in, get as much sleep as those who send their babies to the nursery. Many mothers also report sleeping more peacefully knowing that their baby is nearby. There is so much to learn before you and your baby go home. Our postpartum team will help teach you when and how to feed your baby. They will show you how to change diapers, swaddle, soothe, and bathe your baby. Mothers who room in with their babies report feeling more confident on how to care for their baby when they go home. There are times, however, when it just isn't safe to have a baby in room with the mother. For example, if you are so tired or sick that you are at risk of falling asleep with or dropping your baby, our staff is there to teach you about these dangers. In these cases, we will then recommend taking the baby to the newborn observation unit until rooming in can be safely resumed. In most cases, your baby can remain with you during your entire hospital stay. Routine examinations, lab draws, and screenings will be done in your room. This includes a hearing screen, a test looking for jaundice or yellowing of the skin, and a heel stick recommended by the state of Missouri looking for rare diseases in newborns. The only routine procedure performed out of the room is circumcision. Rooming in is important for all mothers. For breastfeeding mothers, rooming in is particularly important. Moms who room in make more breast milk, make milk sooner, breastfeed longer, and are less likely to need formula. We try very hard to help those wishing to nurse avoid formula. Even one feeding with formula can change the bacteria in the baby's gut. This can increase the risk for diarrhea and allergies. While we try very hard to avoid using formula for those wishing to breastfeed, there are times when formula supplementation may be indicated. If your baby requires formula supplementation for a medical reason, your baby's healthcare team will explain why they recommend this. Now comes the question of how often you should feed your baby. If you remember the simple phrase, 8 or more in 24, you're on the right track. We encourage you to feed your baby whenever you see a hunger cue. We call this feeding on demand or cue-based feeding. Feeding your baby whenever he or she shows signs of being hungry will help you develop a good milk supply and keep your baby comfortable. Babies don't eat at regular intervals. They will sometimes eat several times very close together. This is called cluster feeding. Other times, they will wait several hours between feedings. If you just remember to feed your baby at least 8 times in a 24-hour period, you will be good to go. Here are some signs that your baby may be hungry. Fists moving to the mouth, head turning to look for the breast, becoming more alert and active, sucking on hands or lip smacking, opening and closing the mouth. Many moms think crying is the only sign that their baby is hungry, but actually it's a sign of distress. Hungry babies will show signs of hunger before they begin to cry. Watching for and responding early to your baby's hunger signs may help prevent the baby from crying. Once a baby is crying, it can be hard to get a baby to latch on to the breast. Allowing babies to eat whenever they show signs of hunger helps develop a very good milk supply. Most new mothers do not know how to get their babies to nurse. They worry about having pain or that they won't know how to latch their baby. Our team of nurses and lactation consultants will teach you everything you need to know. Breastfeeding should not be painful. If you are having pain or the skin on your nipple is broken down, these are signs that the latch needs to be adjusted. A good latch should be comfortable for both you and your baby. A good latch is important so that you don't have pain, your milk can transfer from the breast into your baby's mouth, and you develop a good milk supply. We want all mothers to have accurate information so that they can make the decision that is best for their families. Even if you do not breastfeed, having knowledgeable staff trained in infant feeding, placing your baby skin to skin, rooming in with your baby, and feeding your baby on demand are important for formula feeding babies as well. We believe that the baby-friendly steps help all mothers learn to feed and nurture their babies. We are proud of how we care for our mothers and our infants because these steps promote bonding, and healthy bonding makes healthy families and healthy communities. Thank you for taking the time to watch this educational video. We also want to thank all the families who shared their photos, videos, and stories. The beautiful mothers and babies seen here remind us why we have worked so hard to achieve our baby-friendly designation. We hope to continue changing the lives of our patients and their families for many years to come.